Hey everyone, Brian Horning here, your trusted cybersecurity expert. Today we're diving deep into a pressing issue, the rising tide of cyber attacks on U.S. hospitals. Last week, we had two hospitals in Idaho, Idaho Falls Community Hospital and Mountain View Hospital. Both fell victim to a massive cyber attack, what is believed to be a ransomware event. This attack forced both facilities to divert patients and delay elective procedures, which is what we usually see with most hospitals when these kind of incidents happen. Some hospitals, it gets even worse where they have to deny care altogether. But while this incident is distressing, it is unfortunately not unique for many hospitals across the U.S. And this attack is just part of a larger troubling trend that healthcare systems are increasingly becoming targets for cybercriminals with their crucial services and data-rich environments. Cybercriminals know that these medical facilities do not do enough to protect this data, and they know that this data is very valuable to them once they have it. Whether they can extort the organization on the front end or they can sell the data on the back end remains to be seen. But these are two ways that they are monetizing this information through these cyber attacks. The implications of these attacks reach far beyond operational disruption. These breaches potentially put patient lives at risk. It also puts their data at risk. It potentially opens these patients up to things like identity theft and tax fraud. In Idaho Falls and the Mountain View Hospital, the attacks affected every single department from radiology to neonatal care, and the broad scope of these attacks underscores just how much damage can be done. The cybercriminals behind these attacks are using new and sophisticated techniques to bypass security measures. What makes healthcare facilities particularly attractive to these threat active are their critical operations, which due to time-sensitive demands often leave them with inadequate cybersecurity defenses. It also leaves them with the shortfall of talent, budgeting, and the shortfall of knowledge to deal with all these things. So I'm going to get into a few tips in a few minutes on what healthcare administrators can do to help protect their hospitals. Now let's shift our focus on what can be done. Hospital administrators, like I said, this one's for you. How to beef up your cybersecurity. What can you do? It's critical in preventing these attacks. Here are some steps to consider. Number one, as I always say on this channel, it all starts with the risk assessment. So make sure you conduct risk assessments. Understand your vulnerabilities, identify where your security could be improved, and make it happen. We do risk assessments for hospitals all the time, and we arm them with the information how to make it happen and move forward. Train your employees. Your staff, number one, the frontline defense against cyber attacks. Ensure they're educated about the potential threats and how to avoid them. Phishing emails, fake links from social media. What can they connect to? What can't they connect to? What devices are they allowed to bring in? What personal devices are they allowed to use on your network? These are all things that we see hospitals fail to consider and fail to define for their employees. So employees do whatever they want to get the job done. So that means if they have to connect their personal phone or their personal laptop in order to get some work done, they're probably going to do it unless they are educated otherwise that it's not a good idea to do these things. Another thing that you want to make sure that you're doing that we see hospitals not doing across the board on a regular basis, and even if you think you are as you're watching this, I guarantee you're probably not doing this well enough to where a cyber criminal won't take advantage of it. This is probably one of the second popular reason behind phishing attacks that hospitals do get attacked, and that's failure to update and patch systems on a regular basis. Risk assessments will help you identify the things that are not up to date, but this can help protect against new threats and reduce vulnerabilities in your IT infrastructure and is very important. You also want to make sure as you mature your environment that as you add things like security awareness training, multi-factor authentication, and other like basic security measures, you start to look at and invest in advanced security solutions like threat hunting and EDR or endpoint detection and response. Sophisticated attacks require sophisticated defenses. Upgrading your cybersecurity can be a crucial investment. And my point is you don't want to stop where you think you're at a point where you've done enough or you've made it, because that's another mistake we see hospital administrators make all the time that lead to a cyber attack. Create a comprehensive backup and recovery plan. In case of an attack, you need a way to restore your systems quickly, methodically, and with minimal data loss. We usually see hospital administrators and leaders go wrong around this because they fail to plan, they fail to test, and then they are basically going through their testing process during a real event, which means that communication is poor, things are not done as quickly, things are not on the ready to go, and it just takes longer, weeks and months of recovery in order to get back to work. Most hospitals that we have worked with have all gone to pen and paper when they are dealing with a ransomware event, and that takes planning. Where are you going to get this paper from? What forms are you going to pull out? Do you know what forms to pull out? And how are you going to train your employees on how to do it since they've been used to doing it on the computer for so long? Final thing I'm going to say here, a little bit of toot my own horn, but I believe it wholeheartedly because we have such a cybersecurity talent shortage out there. Consult with cybersecurity professionals. As a cybersecurity expert, I can't stress this enough that professional guidance can make a world of difference in preparing and preventing your cyber attacks. It can save you a lot of time and effort and save you money when you have to deal with these things, both on the planning side and if you ever have to deal with an unfortunate event. So the landscape of the cyber threat is continuously evolving, and it's a race to stay one step ahead of these cyber criminals. With improved defenses and vigilance, we can safeguard our healthcare sector from these dangerous threats. If you need help, please reach out to my company. exact cybersecurity and IT. There's links in the description. But for more insights and advice on cybersecurity, please stay tuned to this channel. Like and subscribe to this video. I'm Brian Horning. I'm your cybersecurity advocate. Remember, in the cyber world, knowledge is power. Thank you for watching.